Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 11th lecture on systemic pathology. Today's topic is acute appendicitis. Acute appendicitis. Dear audience, suppose this is the colon, this is the cecum, and this is the vermiform appendix, and this is the terminal ileum. This is ileum, this is vermiform appendix, this is cecum. We are talking about acute appendicitis. What is appendicitis? Inflammation of appendix is known as appendicitis. What is acute appendicitis? Acute inflammation of appendix is known as acute appendicitis. Acute inflammation of appendix is known as acute appendicitis. This is our today's topic. Dear audience, now come to age of occurrence of acute appendicitis. Acute appendicitis commonly occurs in adolescent and in young. Commonly occurs in adolescent and in young. Now come to predisposing factors of acute appendicitis. Obstruction of lumen of appendix is the predisposing factor of acute appendicitis. Obstruction of lumen of appendix is the predisposing factor. Dear audience, suppose this is the vermiform appendix. This is the wall of appendix. And this is the lumen of appendix. And this is the tip of appendix. This lumen may be obstructed here, and this obstruction at the base of the lumen of the appendix is the predisposing factor of acute appendicitis. Dear audience, now come to what are the causes of obstruction of lumen of appendix at its base. Causes of obstruction by fecalith, obstruction by stony hard stool, by stone ingested along with food. So it may be obstructed by fecalith or by any stone that is ingested along with food. Obstruction by tip of worm. Obstruction by tip of worm. If this is the worm and this is the tip of worm, it may obstruct it. Or obstruction by tumor. So obstruction at the base of the lumen of appendix by fecalith, that is by stony hard stool, by stone ingested along with food, by tip of worm, by tumor. Now come to pathogenesis. Obstruction of lumen at base of appendix, accumulation of mucinous secretion within the lumen of the appendix. Accumulation of mucinous secretion in lumen of appendix. Here it is, as there is obstruction, there is accumulation of mucinous secretion in the lumen of the appendix, and this is the mucinous secretion accumulated in the lumen of the appendix. Due to accumulation of mucinous secretion in the lumen of the appendix, there is increased intraluminal pressure of the appendix. Increased intraluminal pressure in appendix. Due to increased intraluminal pressure in the appendix, there will be compression of the vessels of the wall of the appendix. Compression of vessel in wall of appendix. As there is compression of vessel in wall of the appendix, there will be ischemia in the wall of appendix. Dear audience, due to ischemia, there is bacterial invasion in the wall of the appendix. Due to ischemia, bacterial invasion in appendix. Due to bacterial invasion, there is formation of inflammatory exudates. Inflammatory exudates. Dear audience, you know exudates is the extravascular protein-rich fluid results from increased vascular permeability in acute inflammation. Due to inflammatory exudates within the lumen, there is further increase of intraluminal pressure. Further increase of intraluminal pressure. Due to further increase of intraluminal pressure, there will be further compression of the vessel. Further compression of vessel and enhancement of ischemia. Enhancement of ischemia. Dear audience, due to ischemia and due to bacterial invasion, there is acute appendicitis. Due to ischemia and bacterial invasion, acute appendicitis. This is the pathogenesis of acute appendicitis. Again, we recall obstruction of the lumen at base, accumulation of mucinous secretion in the lumen of the appendix, increased intraluminal pressure of appendix, compression of vessel in wall of appendix, ischemia in one of the appendix. Due to ischemia, bacterial invasion in the appendix, inflammatory exudates formed, further increase of intraluminal pressure, further compression of vessel, enhancement of ischemia. Due to ischemia and bacterial invasion, there is acute appendicitis. Dear audience, now come to morphology of acute appendicitis. Gross examination reveals swollen appendix with loss of shininess. Grossly, the appendix is swollen and there is loss of shininess. If this is the normal vermiform appendix like this, when there is acute inflammation, there is swelling of this appendix. Swelling of the appendix with loss of shininess. And grossly, acute appendicitis may be serous type of acute appendicitis, suppurative type of acute appendicitis, hemorrhagic type of acute appendicitis, and acute appendicitis may be gangrenous type. Dear audience, again, grossly, appendix is swollen with loss of shininess. It may be serous type, it may be suppurative type, it may be hemorrhagic type, it may be gangrenous type. Now come to histopathology of acute appendicitis. Histopathology reveals acute inflammatory cell, neutrophil infiltration, in mucus coat, submucosal coat, in muscle coat, and in serous coat. Histopathology reveals acute inflammatory cell neutrophil infiltration in mucosal coat, submucosal coat, muscle coat, and in serous coat. Infiltration of neutrophil in muscle coat is pathognomonic. Infiltration of neutrophil in muscle coat is pathognomonic of acute appendicitis. Dear audience, infiltration of neutrophil in muscle coat is pathognomonic of acute appendicitis. Lumen of appendix is filled with exudates. Histopathology reveals filling of lumen of appendix by exudates, and histopathology also reveals mucosal ulceration. So, histopathology reveals acute inflammatory cells in all coats, especially in the muscle coat. Lumen of appendix is filled with exudates, and there is mucosal ulceration. Dear audience, if the histopathology of the appendix this is the serous coat, this is the muscle coat, this is the submucosal coat, and this is the mucosal coat. This is the ulceration, that is mucosal ulceration. Lumen is filled with exudates. This is exudates. In all coat there is infiltration of neutrophils. Especially in muscle coat. So infiltration of neutrophils. This is the histopathology of acute appendicitis. Dear audience, now come to what are the complications of acute appendicitis. Appendicular lump formation, by appendix itself, by omentum, by loop of intestine. appendicular lump formation. Burst appendix, patient may suffer from peritonitis. So, appendicular lump formation, burst appendix, peritonitis are the complications of acute appendicitis. Dear audience, today I have told you about acute appendicitis. This is the acute inflammation of appendix. It may occur in adolescent and in young. The predisposing factor is the obstruction of the lumen of appendix at base, usually by the fecalith, stony hard stool, by stone ingested along with food, by tip of worm, or by tumor. If there is obstruction at the base, there will be accumulation of mucinous secretion in the lumen of the appendix. Due to accumulation of this secretion, there will be compression of the vessel of the wall of the appendix. Due to compression, there will be ischemia. Following ischemia, there will be bacterial invasion. And due to bacterial invasion, there will be inflammatory exudates formation. Due to inflammatory exudates, there will be further increase in intraluminal pressure and further enhancement of ischemia. This ischemic injury and bacterial invasion is associated with acute appendicitis. Dear audience, the morphology of the vermiform appendix in acute appendicitis, it will be swelling and loss of shininess on gross examination, and gross examination may reveal serous type of acute appendicitis, suppurative type, gangrenous type, hemorrhagic type of acute appendicitis. Histopathology reveals neutrophil infiltration in all layers, especially in muscle coat, and infiltration in muscle coat is pathognomonic of acute appendicitis. There may be filling of lumen of appendix by exudate. There may be mucosal ulceration. And complications may be formation of appendicular lump here by inflamed appendix, by omentum, by loop of intestine. Appendix may burst and there may be peritonitis. These are the complications. Dear audience, I have told you infiltration of neutrophil in all layers is found in acute appendicitis, and I have told you infiltration in the muscle coat is pathognomonic. Why? Why neutrophil infiltration in muscle coat is pathognomonic? Dear audience, suppose this is the colon, this is the cecum, and this is the vermiform appendix, and this is the terminal ileum. Neutrophil infiltration only in serous coat may be due to peritonitis. Infiltration of neutrophil only in serous coat may be due to peritonitis. Dear audience, if anybody suffers from peritonitis, due to peritonitis, the neutrophil infiltration may only be found in the serous layer of the appendix. If we get neutrophil infiltration only in serous cord, it is not acute appendicitis, because this neutrophil infiltration in the serous cord may be due to peritonitis. Neutrophil infiltration only in mucosa may be due to drainage of exudates from higher level of bowel. There is neutrophil infiltration in mucosa may be due to drainage of exudates from higher level of bowel. You know, exudate is the acute inflammatory fluid and it contains neutrophil. There is, if there is acute colitis here, due to acute colitis here, above the appendix, there is the formation of exudates, and the exudates contain neutrophil, and this neutrophil may enter into the appendix and it may infiltrate in the mucosa. So, neutrophil infiltration only in mucosa may be due to drainage of exudates from the higher level of inflammation. So, neutrophil infiltration only in mucosa may be due to drainage of exudates from the higher level of the bowel. Neutrophil infiltration in muscle cord not due to peritonitis or due to drainage of exudate from higher level of bowel. Neutrophil infiltration in muscle cord not due to peritonitis or due to drainage of exudates from higher level of bowel. But neutrophil infiltration in muscle cord is definitely for acute appendicitis. It is for acute appendicitis. So neutrophil infiltration in muscle cord is pathognomonic of acute appendicitis. Dear audience, this is all about the acute appendicitis briefly. Today up to this, thanks all.